As the malaria drug hydroxychloroquine gets more attention from doctors and even President Trump, a new study highlights some concerns about the drug that is being used in some to treat COVID-19. Eyewitness News' Mike Pickett with reaction tonight from doctors and families of those being treated with it.
Since last week, the family of Mamie Wright, a resident at Ridgewood Terrace Nursing and Rehabilitation in Madisonville, says she's been using hydroxychloroquine with the zinc and Z-Packs as part of her treatment.
They say that she's sitting up in her bed this morning and she's fine, that she's still on the medication and doing okay.
Her daughter, Paula Shockley, says Wright isn't having side effects she knows of, but had questions about the drug after learning of it.
The only thing that I was concerned about, like I said, I had recently heard that it can cause heart issues. My brother, on the other hand, says that, it's a medicine that's been around for a long time.
A recent study of 368 patients at Veterans Hospitals showed 28% of patients given the drug plus usual care died, compared to 11% who just got usual care. About 22% of those who took it with azithromycin also passed away. But Dr. James Buckmaster of Corpus Christi Clinic, whose patients use hydroxychloroquine as one part of treatment, says the study didn't look at those using it with zinc.
After I looked at the study a little closer, I realized that they did not include any zinc with it, and without that 1-2 punch, would you take the hydroxychloroquine and then drive the zinc in there, it's not going to work.
Dr. Buckmaster says he still plans to let patients use the drug with zinc for treatment. He adds the earlier people treat symptoms, the better.
You look at the risk and the benefit. The risk of the disease far outweighs any risk of the medicine.
In Henderson, Mike Pickett, Eyewitness News.